Welcome to another edition of the Dementia Care Partner Talk Show. Now, here's dementia care expert Teepa and your host, Greg Phelps.
Hello and welcome to the Dementia Care Partners podcast. My name is Greg Phelps. Joining me as usual is Teepa Snow. And Teepa, our topic today comes from I think it was a day-long conference in Winnipeg, Manitoba, where care providers were asked about their top 3 concerns when providing support and care for persons living with dementia. Now, the little pie chart that I got came through in black and white, so I'm kind of running a little bit blind here, but it looks like the usual suspects are in the lead. Refusing care, wandering or eloping, falls, want to go home, things that are taken or stolen, sleep issues, threatening care staff, and the list goes on. So did I sort of read that pie chart correctly?
Yeah. So people are not, it's interesting. They're not thinking, I wish I knew more about dementia so I could understand why it is people are doing things that seem irrational and illogical to me. But I know from their perspective must make sense because otherwise they wouldn't be doing it. I mean, humans don't do what doesn't make sense to them. So, I wonder what's going on. People don't ask that. There's an immediate shaking the finger and blaming. The person is wandering versus there must not be enough environmental cues around to allow the person to get where they want to be, or they are not where they want to be and they can't figure out how to get there. And so they're often either looking on their own or seeking support, which means I'll say, hey, listen, can you tell me how to get to my house? I don't have any idea how I got here. Somebody dropped me off, I guess. And so, or resisting care, which means that which you are trying to offer me, I don't think or want, either due to sensory issues or due to a sense that I've already done that, or a sense that this is not your job and I'm in charge of me, not you. And so without skill, that's not going to change. And people want them to just stop doing those things. And it's like, so you can't have what you want as a carer. Maybe we haven't prepared the carers accurately.
Well, with skill, it's a challenge. Without
Absolutely.
skill,
And it's compromise. You have to be willing to compromise. I don't always get what I want. I mean, that's the reality. I mean, I am not always going to get what I want as a carer because it's not my care. It happens to be your care with me involved. So that idea of we've got to really transform our thinking and our behavior to better match who we're serving if we even have a chance at this and have it go well for both of us.
So where do you start? Well, we'll leave families aside with this one because
Mhm.
we're sort of on to the
Yeah,
institutional.
this was a lot of professionals coming together in Winnipeg, for sure,
So
and teams.
it's like any organization, I guess. It basically starts at the top because you've got the generals, you've got the second lieutenants, and et cetera, et cetera.
Yeah.
And then you've got the foot soldiers. But quite often we've got a good looking foot soldier or a foot soldier who's got a piece of paper that says I'm smart, and we put them in charge. Now, I don't mean to denigrate people, but it does seem like that when you observe this happening consistently, you sort of go, there's a pattern here.
There's a huge pattern here, and the huge pattern is if you teach me tasks and you teach me how to do tasks, you teach me how to do tasks on mannequins, and you teach me the procedures for doing those tasks, then when you give me a human being that is reasonable, logical, rational, like someone in the hospital, well, wait, someone in the hospital who's just had a procedure done, who might have changes in abilities due to the anesthesia or due to the residuals or due to new things coming out of their body or the inability to do things how they have before. I'm not sure that always worked well, but when you're in the hospital, who's the boss at the hospital? So we sort of, I mean, that's where people living with dementia also have huge, huge problems with care. But then we just roll that over into long term care and we roll that over into home care with a provider. And what we haven't done is go to the root question of so you're trying to give care with tasks on a mannequin to a human being with a changing ability state. maybe we should start building relationships with that person so we get to see who they are, what they like, what they don't like, what their abilities are, where they have flaws and inabilities, where I might have some challenges, how they feel and think about me as someone who's going to be in their intimate space before I start trying to be intimate. And when I say that, Greg, what are some things you know that carers do with people who they don't know, frankly? They don't know them. They're doing it because it's their job. What are some things you know that are being done with people that you have to be able to tolerate?
One of the biggest ones that I see
Mhm.
constantly is attempting to give care or engage without making first an actual approach.
Mm, yeah,
And that one generally goes sideways, probably in the high 70% range.
70% of the time. Because I don't want somebody putting food in my mouth. I don't want somebody moving my plate. I don't want somebody touching my body. I don't want somebody trying to get me on or off a toilet. I don't want somebody trying to tell me I can't go out the door. I don't want somebody taking away my car keys. I mean, think of the things I would not want without my permission and without a relationship that I gave permission, and you get the problem. I mean, that's the true problem. What we would not do for like you on the street, I feel comfortable trying to do with somebody who has significant brain change and call it care. And it's like, I don't know how we ever got into that habit, but we should never have been allowed to do it in the first place. And now we're having to really realize these are not individuals that have committed a crime and therefore should be incarcerated because of the crime they committed knowingly. Um, and they're not a person who's not able to indicate whether they like something or not. We're just not willing to listen and observe that they're not liking what's happening and that they have a right not to like it. And it's their rental property, not mine. Um, I'm not the boss of them. I'm asking to support and serve them.
This isn't just dipping somebody's toe in the pool. This
Mhm.
is somebody dipping their toe in the ocean. So how can somebody sort of get some basic knowledge? Because without the
Yeah,
first little even glimmer of understanding,
yeah.
you're going to be overwhelmed.
Yeah. So if you were to go to our website and you were to look, we have a dementia awareness quiz. So do you know what you think you know? Are you aware of what might actually be important to know before you get started on this journey of helping somebody? And if you don't, there are suggested very simple videos that we put into the mix to help your brain go, oh, and then if you're interested past that, we have the opportunity of skill building, knowledge building, awareness building, because we believe that until we start going back and recognizing, I don't know what I need to know, we can't change what's happening. It's too hard to try to fix a broken system. What I can do is open the door for somebody who's come to find out.
Teepa, thank you very much.
Thank you, Greg.
You've been listening to the Dementia Care Partners podcast. For more information on today's podcast or any other dementia related topics, go to teepasnow.com.